Hey, this is Dr. Bill with just the tip of urology school. This episode is going to tackle urinary tract infections. Real important. It's really a mainstay of what we do in the clinic. It's a common diagnosis. We also see it at increased rates during after hour calls when we take emergency calls. So have a game plan. Familiarize yourself with urine and culture and sensitivity reports during your clinic time under the physician's mentorship, and get a comfort level in prescribing, and certainly a comfort level in what common antibiotics are, their common side effects and contraindications. For instance, we use a lot of sulfa-based drugs for UTI, and we don't want to use those in patients who are on concomitant Coumadin as a blood thinner. That can prolong the impact of normal Coumadin doses and cause a proclivity to excess bleeding. Understand that sometimes we need to use a parental route for antibiotics, and that can be done with the help of home health care or even daily visits in our clinic during the day for IM injections. Don't be afraid to consult with infectious disease physicians and our hospital pharmacists. They can always give us updates on what community acquired bacterial infections are and the best mode of treatment. Have an understanding when it's prudent to hospitalize a patient for additional surveillance and an upgrade in care. When you look at the AUA material, this chapter on urinary tract infections have a number of algorithms and tables that are certainly of benefit. Our goal is not only to determine who needs treatment, but to offer the appropriate treatment, limit risk factors, and as importantly, prevent future urinary tract infections. Be aware of the appropriate antibiotic, the duration, and particular side effects. We also be aware that over the last few years, the fluoroquinolone, Cipro, has really been a great weapon for us. However, it has been overutilized, and we've seen the result of that, increased resistance, which limits our use for people and patients who really do need the Cipro. So or particular fluoroquinolone. So use the antibiotic that has the not only the appropriate sensitivities, but for the appropriate length of time, and also one that is least likely to offer resistance for our patients. We also want to look at risk factors and mitigate those factors: diabetes, obesity, sickle cell disease, urologic issues, as well as neurologic issues, anatomic abnormalities, kidney stones, increased catheter use. We see increasing risks of urinary tract infections with sexual activity and the use of diaphragms and spermaticides. Also, we look at the frequency of urinary tract infections, family history of UTIs, increased parity, urinary incontinence, as well as benign prostatic hypertrophy. Also get a good feel for when to treat and not to treat. There is a group of patients that have asymptomatic bacteriuria. Those shouldn't be treated. We understand that our senior population, we're a little more inclined to treat those infections because of the increased risk of mental status changes, and certainly worsening dementia. Patients who are in the category of asymptomatic bacteriuria who should be treated are patients who are pregnant. They have an increased risk of developing symptomatic UTIs with associated risk for the fetus, and those patients who will undergo urologic instrumentation. So it is a actually underrated subsection of urology. There are a lot of ins and outs and fascinating tidbits that we can utilize. The patient ultimately is the person who tries to manage the UTIs themselves. There are a lot of home health kits that will help them decide if they have a UTI. Those are not always accurate. They tend to hoard antibiotics and treat when they desire without any scientific approach to their treatment, and commonly fail follow-up because they're feeling better. But eventually they'll come back with increasing complaints. So also it's important to, above all, try to encourage compliance to your patients with UTIs. Look at the material in the AUA. There are a number of other articles, not only in family practice, but in NPPA journals that will help you work with the management of UTIs. Dr. Bill, with just the tip of urology school and urinary tract infections.